Before we start today's episode, I would like to quickly read you our podcast disclaimer. The content in this podcast is for general reference and educational purposes only. It is not meant to be complete or exhaustive or to be applicable to any specific individual's medical condition. No information provided in this podcast constitutes medical advice and is not an attempt to practice medicine or to provide specific medical advice, diagnosis, or treatment. This podcast does not create a physician-patient relationship and is not a substitute for professional medical advice, diagnosis, or treatment. Please do not rely on this podcast for emergency medical treatment. Remember that everyone is different, so make sure you consult your own healthcare professional before seeking any new treatment and before you alter, suspend, or initiate a new change in your routine. Welcome to The Starting Gate. We're your hosts, Dr. Kitty Dotson
and Dr. Sarah Sheets,
two internal medicine doctors who spent years practicing traditional primary care. Over time, we realized something was missing from modern healthcare. A real understanding of how everyday lifestyle choices impact overall health.
We'll help you cut through the noise of the countless health influencers and their conflicting opinions. Because no matter who you follow, the basics of lifestyle medicine are at the heart of it all.
Welcome back to The Starting Gate. We're your hosts, Dr. Kitty Dotson
and Dr. Sarah Sheets.
Well, we're excited to continue talking about women's health topics this week, and we're going to get into a topic that sometimes people don't always want to bring up because sometimes it can be a little embarrassing, the symptoms that come along with it, and that is pelvic floor. So we are going to talk about pelvic floor weakness, pelvic floor tightness, why you might have these, and how they might affect you.
And we are thrilled to have our guest today, Dr. Kelsey Karnes. Dr. Karnes has her doctorate in physical therapy and practices at Move Smart, and she is dedicated to injury prevention and also improving awareness about pelvic health. I have heard her speak on this topic, and she does a great job, so we're super excited to have her today. But before we get into our topic, can you tell our listeners about yourself and how you ended up in your career?
Yeah, so I'm super excited to be here. Thanks for having me. So I ended up in physical therapy just through, choosing a profession kind of situation. I knew I wanted to be in the medical field and I really liked helping people. And so I chose physical therapy and I started out as an orthopedic physical therapist. So kind of your traditional, PT, like if you sprained your ankle, the PT you would go see. And then I myself struggled with some pelvic health issues and had to go see a pelvic floor physical therapist. And it was life-changing for me. And I thought to myself, I want to be able to provide this service for people. And so I went back and pursued a lot of continuing education courses to become certified to do pelvic health, and the rest is history. So that's what I've been doing for the last 5 or 6 years is like solely pelvic health. I still do a little bit of ortho, but mostly pelvic health, and I love it.
And so that is a separate training aside from just general physical therapy that you had to go through.
Yeah, so it's an additional training. We get some knowledge in it in physical therapy school. It's actually getting better. Like I really didn't have much. I just had like one lecture about pelvic health, but there's organizations that train you past PT school in being able to practice in pelvic health.
Is there a way to find PTs that have this specific certification? Is there a database or anything our listeners could use if they're not in the local area, if they're looking for someone like this?
Yes, absolutely. There's two. So the APTA, or American Physical Therapy Association, I think it's apta.org. You can do a practitioner search for pelvic health. And then the organization I went through is called Herman and Wallace, and they have a website called pelvicrehab.com. And you can just put in your zip code. They'll show you all the practitioners in your area, where they're located, a little blurb about them. And it's a really awesome tool. I send it to people that reach out to me from areas that aren't here all the time. So,
Great.
Yeah.
Great. We'll put links to those in our show notes
Perfect.
If you're looking. Well, can you start out just by telling us what is the pelvic floor?
Yes. So this is one of my favorite questions. So the pelvic floor is a group of muscles that sit at the bottom of your pelvis. So I've brought my pelvic model today. I think you guys are going to attach a little video of it so that people can see. But so it's a group of muscles that sit at the bottom of the pelvis, and they basically are responsible for helping to control urination, urination, defecation, so having a bowel movement. They control a lot of factors in sexual health, and those muscles kind of function like a support for the organs of the pelvis. So like your bladder, your uterus, if you're a woman, your rectum, and they help to kind of tighten and relax to allow us to use the bathroom, to allow us to not use the bathroom when we don't want to. And they work really just like any other muscle in your body.
And so I had always thought about pelvic floor weakness being a problem, but I've recently also heard that pelvic floor tension is also a problem and maybe just as much as weakness. Can you tell us a little bit more about what kind of symptoms would you have if you have pelvic floor weakness, and what might you have if you have pelvic floor tightness?
Yeah, that's an awesome question. So I would say at least 75% of the time in cases that I'm seeing pelvic floor tightness is probably more of a driving factor than pelvic floor weakness. It's pretty rare that I ever see a patient that comes in with just like true weakness. So symptoms can kind of swing across both continuums, which is why I always tell people, just because you have this set of symptoms, we can't always categorize you in one direction or the other. That's why it's important to see a practitioner that specializes in being able to assess and treat the pelvic floor, because they need to figure out where on that continuum you swing. So in general, symptoms of pelvic floor tension might be pain with sex, pain with pelvic exam, pain with putting in a tampon if you're a woman. And then it could also be constipation in both male and female. It could be painful urination or feeling like you can't fully empty your bladder all the way, or you have like a hesitancy or your urine stream starts and stops. For male patients, it could be difficulty with erection. It could be, various types of sexual dysfunction. It could be pain just in sitting in general. So that's more of the pelvic floor tension side of things. Pelvic floor weakness, and I would argue that pelvic floor tension can also have this symptom, can lead to urinary loss. So urinary leakage, peeing your pants when you cough or sneeze, or when you exert yourself, or feeling like you have to pee and you can't make it to the bathroom in time, or feeling like a pelvic heaviness, or you might hear words like prolapse thrown around in the medical realm. So symptoms such as that can be more categorized along that trend of weakness. But again, it's a continuum, and it's rarely ever one or the other. It's usually a little bit of both.
And before, most of today we're talking about women's health, but I do want to take one moment to pause. You have mentioned some symptoms that men would have. Can you just give a quick overview on when men should be worried about pelvic floor weakness and some of their most common symptoms? And then the rest of the time we'll go back to women, but I do want to at least highlight some of those.
Yeah, no, that's great. So things like sexual dysfunction, so erectile dysfunction, pain during ejaculation, urinary loss. And I usually see that more in males like after post-prostatectomy. So when they have their prostate removed for cancer or various surgeries, that's typically more of the trigger in males for urinary leakage. Constipation is a huge one that I feel like guys don't acknowledge, and that is a huge driver for pelvic floor dysfunction. And then in our male athletes, a lot of times it might be like pelvic pain with squatting or lifting or bending or throwing or different things like that. So those are some of the symptoms that we see most commonly in male patients. And like I said, most of the people that are coming to pelvic floor PT are post-surgery, but there's still a lot of guys out there that need help that just don't recognize that there's help out there.
Okay, so flipping back to women, I think the thing that comes to mind for me most when I think about what has impacted my own pelvic floor over my lifetime would be pregnancy. So what happens to your pelvic floor during pregnancy?
Yeah, so that's a great question. So during pregnancy, your posture changes is like one of the first things that starts to change. And when our posture changes, the positioning of our pelvis changes, which is going to impact the muscles that attach to it, like our pelvic floor, our low back, different things like that. So our pelvic floor, like I mentioned earlier, is a support structure. So it sits at the bottom of the pelvis and provides a little bit of support to the pelvic organ. So as your belly grows and as weight gets added to the system, that happens more towards the front of the body. So your center of gravity kind of shifts forward and your pelvic floor kind of takes a little bit more load. So those muscles can respond in a variety of ways. They can kind of learn to relax and accept that load and become more elastic. Or in a lot of people, those muscles feel that load and they respond by tensing up. And then that can cause a variety of issues as far as pain, constipation, urinary leakage, that kind of stuff in pregnancy. The other thing that happens during pregnancy is we're going to have a secretion of a hormone called relaxin, which is going to make the ligaments in our body, so ligaments are what holds our bones together, they're going to make them a little bit more movable. So those ligaments are going to become a little more elastic during different points of pregnancy. I usually see it more in that first trimester and third trimester. And so when those ligaments become just a little bit more mobile, our muscles have a greater role to play in stabilization. And so our pelvic floor kind of gets asked to do a little bit more in addition to our abs, in addition to our low back, our hip muscles, and everybody's body can respond to that a little bit differently. But those are some of the changes that kind of happen as pregnancy progresses.
And so if those muscles are relaxing and ligaments are relaxing, and in my mind, like I picture it, they're stretching out, then after pregnancy, does everything go back to where it was?
Yeah, so that's a really great question. And this is something that was pretty controversial in the literature when I kind of looked through, like, what does literature actually say? The duration of time it takes postpartum to recover. And so not a lot of studies have been done super long term. And so most of the studies say like, 6 weeks for everything to go back to muscles and uterus and bones and stuff to go back to normal, but up to 6 months for, you to feel like pre-pregnancy. And I would even argue, and a lot of people in my field would argue, that 6 to 12 months is usually the duration of time it takes for things to
6
really...
6 weeks is BS.
Yeah, exactly.
It definitely took me at least 12 months to feel like that area was back to
100%. And especially too if you're breastfeeding. So your hormones are still going to be taking a little bit more time to adjust. And so if you're breastfeeding, you're going to have a little bit more of those movable ligaments. And so your pelvic floor muscles are going to be doing something a little differently. And so I would argue that 9 to 12 months is more accurate for what I tell people. I usually say it takes you 9 months to grow a human. It takes your body 9 months to recover from that. Like, that's a big thing. And so postpartum, the biggest things that we will see is postural changes that can and may not be always associated with pain or discomfort, like in the low back or the pelvis. Another thing we see is things like rib flare, meaning our rib cage actually widens during pregnancy to be able to support the growth of the baby.
I hear about that a lot on social media.
Yes, everyone talks about the rib flare.
Is that something that's reversible?
Absolutely, it is. Yeah, and I think that's what we don't talk about on social media. And I think sometimes social media can just get really caught up in like the visual aspect of it. But rib flare can impact our ab muscles' ability to work as well as it did pre-pregnancy. And so we want to address it not just from an aesthetic piece, but we want to address it to help our musculoskeletal system and our core function most optimally. So as your abs get stronger in the right way, that rib flare will naturally kind of correct itself.
And what about in someone that's just contemplating pregnancy or knowing they want to try to get pregnant in the next year, let's say? Is there anything they can do from a preventive standpoint to try to best optimize their pelvic floor for this baby load coming?
Yes. So that's a great question. People ask me that a lot. So the biggest thing I can say is just get in touch with your pelvic floor. If you're like, what the heck does that even mean? There are amazing resources out there. Social media has done a lot of wonders in our field of pelvic health. I have written a lot of blog posts. So I'm sure we can link to it in the show notes, but I've written several blog posts on like, how do I even know what's happening in my pelvic floor? And so just getting mentally connected with that aspect of our body is probably the hardest part of pelvic floor rehab in general. And if you can have a leg up on that prior to pregnancy, then you can start to notice, I'm starting to notice maybe I'm holding a little bit more tension here, or I'm starting to feel a little bit weaker here. And then the biggest thing is learning to be able to relax your pelvic floor. So as you work on that awareness piece of things, one of the things all of my patients come and tell me is I've been doing 100 Kegels a day all throughout my pregnancy because gosh dang, I'm going to have the strongest pelvic floor ever to push this baby out. And I'm like, okay, so we're gonna change the script a little, and actually your pelvic floor strength has nothing to do with your ability to push the baby out. It had and everything to do with, causing more complications with that, right? Because your pelvic floor muscles actually have to relax to allow the birth of a baby vaginally. And so that's one of the biggest things I see in pregnancy is overtraining the pelvic floor. And so just going into it knowing like, hey, I'm not gonna be that person that is like doing a million Kegels a day, really really concentrating on being as strong as possible. I would rather focus more on being aware of my body and being able to relax those muscles so that as I'm birthing and as I'm laboring, I have the ability to be able to connect with that and relax to allow the birthing process to take place.
Great advice. Absolutely great. This brings up the next question, and I think I answered this wrong for myself, is you have your first child and you're like, well, I think I might want to have try to have another child. So I'm not really going to work on improving my pelvic floor strength because I'm just going to, ruin it again
Yes.
if I get pregnant again. What should someone do in that situation?
Yeah, so I actually get a lot of patients that come and say that. And then I always feel bad, too, because a lot of times people will come see me after they're done having kids, and they'll be like, I feel so bad I didn't come see you sooner. And I was like, don't feel bad. The beauty of the pelvic floor and our bodies is that, it's never too late. If you are 3 or 4 pregnancies in and you're like, man, I definitely have neglected my pelvic health, no worries. Almost everything is reversible. So first thing, don't panic. But second thing is it is always beneficial to do some pelvic floor work in between pregnancies. And maybe not even just when I say pelvic floor, I think more like our whole core system. So the pelvic floor, and I should have mentioned this earlier, is part of our core. So when you go to the gym, you're like, we're going to do some core strengthening. The pelvic floor is the bottom part of our core. Your abs are the front. Your diaphragm's the top, so the diaphragm's what you use to breathe. And then your back muscles are the back of your core. And so working on all 4 of those components between pregnancies is huge. And I will honestly say that my patients, I've practiced long enough to be able to give a little bit of stats on this, but my patients who do pelvic floor PT in between pregnancies have so much easier of a time. Postpartum recovery is faster. Now, obviously, that doesn't take into account if there were a lot of birth complications and stuff. But for uncomplicated deliveries, people who choose to do some pelvic floor PT, even if it's 1 or 2 sessions during pregnancy and in between pregnancies, tend to recover so much better because they have that foundation of how to use their core.
Speaking of core, this one also very important to me is, can you explain how diastasis kind of comes together with all of this situation?
Yes, absolutely. So when we're pregnant, pretty much research shows that 100% of women at their 38 weeks of pregnancy have what's called diastasis. Diastasis is basically a separation or a widening between the 2 muscles of your abs that form your 6-pack muscle, if you will. So those muscles are going to widen just a little bit at the end of pregnancy to make room for your growing belly. They're not pulling completely apart. There's connective tissue that connects them, so don't panic. And it's very normal. But then postpartum, most of the time, those muscles will just kind of go back towards one another, and that gap will narrow to about what we call, a normal distance. There should be a little space there. But in a lot of cases, it doesn't. And so the research is a little bit all over the place with this as far as the percentages of women, but we still see a pretty strong percentage. I think the last time I looked, it was over 25% at 9 to 12 months that still have some diastasis. And so where this becomes an issue clinically is muscles like to have a certain length that they like to live at. And so we talk about a length tension relationship. So if a muscle is really lengthened or really shortened, it's not going to be able to produce as much force. And so when we have ab separation, our muscles can be in more of a lengthened position, and so they may not work as well. And so we might experience things like back pain or hip pain.
Because they're compensating for that muscle that's not working as well. Is that why you would have that?
That, or just you're not getting enough support to those areas. So if you're having some back pain from your spine or some disc issues because your abs aren't able to provide the stability and the support that you need, it can lead to pain. Or, the biggest thing I see is SI pain, sciatica, that kind of stuff. So if your joints aren't getting the support that they need from the muscles because those muscles still haven't been able to get back to the length and alignment that they need because you have diastasis, then it can lead to other things like pain and things like that.
That's something I was not very well aware of as a primary care doctor, but then I personally experienced it, had the back pain, really was what's going on? What have I done in my back? And really working on that core was the answer. And it was amazing.
Yeah, that's awesome. That's awesome.
So anyways, just because I have experienced that, it's sometimes not talked about a lot, and women don't make that connection. So we just want to be sure, as we're talking about the pelvic floor, that we are talking about the whole core as well, because a lot of these things are connected.
Yeah, 100%.
Speaking of misconceptions, when you've had a C-section, I think a lot of women assume, well, I had a C-section, so I'm not going to have any of these pelvic floor issues or urinary leakage or anything like that, as opposed to my friends that had vaginal deliveries. What is the difference you see in women that have C-sections versus vaginal deliveries?
Yeah, so that's an awesome question. That's a huge misconception that I feel like most of my patients will say. They're like, oh, I don't need a pelvic floor PT. I had a C-section. And first off, let me just say that your pelvic floor still endured 9 months of carrying another human being. Okay, so let's just start that there. Okay, so there was still a lot of load put on your pelvic floor. Your body still went through a lot of postural changes. So your alignment and different things is changed. Your muscle length and tone has changed. So baseline, all of those things are impacted. And then I clinically, now this is not, I'm not writing this up in research, but clinically what I have seen post-cesarean is a lot more issues with pelvic floor tension because it compensates for the abs wanting to be more shut off, right? Like we have this painful scar. Our ab muscles have just gone through a lot with the cesarean delivery. And so those ab muscles are going to take a little bit more time than with a vaginal delivery to kind of recover and be able to rehabilitate and activate like they need to. And so in a lot of cases, I see the pelvic floor take on that load. And so I've got a lot of people that'll come to me and say I'm having a ton of pain with sex, post C-section. What the heck? I didn't even deliver my baby vaginally. And I'm the pelvic floor still, first off, undergoes a lot during pregnancy, but then really does try to compensate a lot postpartum.
Another thing for many women out there is we have normalized the fact that when we do certain things like jump on a trampoline or we're doing high impact exercises or running, that it's normal to just pee on yourself. Can you please talk to our listeners about this?
Yes. Okay. So it is not normal. It is common. 1 in 3 women experience leakage in the U.S. So that's insane, first off. That's a significant number of people, but it's not normal, and it can be treated and it can be prevented and it can be fixed. So if you're out here listening and you're rocking out your black leggings at the gym because you're oh, I'm just going to have a little bit of leakage when I do that HIIT workout at the gym this week. I'm just going to wear my black leggings. I'm not going to worry about it. There's nothing. I've just had babies. My mom says this is normal, whatever. Just please hear me say that if you don't want this to be normal for you, then please reach out to a local pelvic floor PT because it doesn't have to be.
We were actually talking at a girls' lunch not long ago about absorbent underwear.
Yes.
And we're we need, does anyone have any absorbent underwear recommendations for when we go to the trampoline park?
Yes. I will say one time I had a rep for absorbent underwear come to my clinic, the last clinic I was working at, and try to sell me products. And I'm do you realize I'm trying to put your company out of business? I'm over here trying to not, have people need these things. So I'm sorry I won't be purchasing your products today.
And so even for someone, I have multiple friends that have had twins.
Yeah.
And I assume that they are probably worse off than I am from the trauma to their pelvic floor during pregnancy. So even someone that's gone through a very large twin-type pregnancy, they can recover from this and not leak?
Absolutely. Yes.
And last question, as we're kind of rounding out the pregnancy aspect of this talk, is there a point of no return? If you are 6 years since your last pregnancy and you're still dealing with this and you're man, I wish I had done something postpartum. I missed my window. What is your response?
So I would say in most cases, no. Now, there are some exceptions, and you had mentioned twin deliveries, and certainly not all the multiple birth deliveries do I see this, but if someone has severe trauma during a delivery, whether that be they had to have an assisted delivery and had significant tearing and they needed surgery, or they have significant prolapse, there are some cases where pelvic floor PT by itself is not going to be enough. You may have to have some additional support from either surgery or offer internal support devices or different things like that. So let me just say there are exceptions to the rule, but those are rare. And to answer your question about am I ever too far gone, the answer is no. And I honestly didn't believe this myself when I started practicing. I had a patient come to me 9 years post cesarean delivery. She wanted to heal her diastasis, and it was probably one of the most significant diastasis I've ever seen, and get feeling back in her C-section scar. And she asked me what her prognosis was. And I was a new therapist, and I said, we're going to do the best we can. Like, I can't make any guarantees with you. We're going to do the best we can. She worked super hard, did everything I asked her to do, and she not only regained full sensation back into her scar 9 years post-cesarean delivery, but also completely healed her diastasis and was able to participate in all of the core stuff she enjoyed doing, like Pilates, workouts at her gym. And to be honest with you, I was shocked, right? Like I told her that at the end too. And so after that, I really stopped ever putting limitations on time post-delivery. Like, the body is awesome. There's a lot we don't know about tissue healing. And so I always tell people you're never too far gone if you want to try.
And for someone who comes to you for this after postpartum, what is a typical course of PT that is required? Like the shortest versus the longest that you usually have to work with patients?
Yeah, that's an excellent question. I usually tell people anywhere between 8 to 12 weeks, but I have, and I usually see people like once a week kind of thing. In a lot of cases, people can't make that happen, so I might see them every other week or stuff like that. But for people that will see me during pregnancy or preventatively prior to pregnancy, sometimes I only see people for 3 to 4 visits postpartum because they worked on a lot of this stuff ahead of time and then, worked on proper rehab, in those first 6 weeks postpartum. And so it can be as short as like 3 to 4 weeks, but on average, most of the time I'm seeing people for about 8 to 12 sessions postpartum over the course of that kind of year postpartum.
And so they're seeing you once a week, and then are you giving them homework to do?
Yes.
At home?
Yes, they get homework. And so I work with them on it because most people are like, Kelsey, I have a newborn. How am I supposed to do this homework? Right. So we make it very functional. So don't let homework scare you away from going to pelvic floor PT. We can work it into your day-to-day life.
So thinking about pregnancy, kind of stretching your muscles to the point of where they're not functioning optimally and then they come back down, do you see similar effects when people have lost significant amounts of weight?
Yeah, that's a really good question. So, and I'm seeing a lot of this with the GLP-1 drugs where people are having rapid weight loss. I can see it swing both ways, right? So if you lose weight, there is less pressure on the pelvic floor. So if you're suffering from some dysfunctions that are related to increased pressure, such as prolapse, some cases of leakage are related to that, then some of those things will get better as weight loss is achieved. But what I'm seeing most often is that a lot of new symptoms will emerge for people. So people that maybe didn't really ever have any issues with leakage or pelvic pain or constipation is a huge one that I'm seeing with weight loss, a huge one, especially when it's like rapid weight loss from medication. Then those things can start to develop and people are like, wait, I've never had this before. And it's because the changes in our body happen so rapidly that our muscles just aren't keeping up with it. And another thing that I'm seeing a lot with a lot of like medication-induced weight loss is that the weight loss is happening so quickly that people aren't also pairing it with doing things like strength training or muscle re-education, right? Like our body, our posture, our muscles, and everything is changing so quickly, and we're not doing any type of strength training to the muscles to help them adapt to those rapid changes. And so I see a lot of issues with back pain, pelvic pain, hip pain, and stuff related to that too.
So with that being said, if someone is having weight loss from these, if they work on their resistance training as well as focusing on their core, is this something that you can improve the outcomes?
100%. Yeah. So I would also say, I know you guys did a podcast episode on label reading and the importance of fiber and stuff like that. So I would say considering nutritional implications too. So I have a lot of people, I have a lot of people that are doing medicated weight loss, and some of them are really targeting, making sure they're getting adequate nutrition, so adequate fiber, adequate protein for muscle rehab and all of that stuff. But then others are just not eating at all. And so when you're not getting that adequate fiber or that adequate protein, you're not going to, well, if you're not getting adequate protein, your muscles aren't going to recover well, even if you are trying to do some resistance training. And if you're not getting adequate fiber, you're going to be more at risk for things like constipation, bowel dysfunction, which is going to really impact the pelvic floor strongly as well. So I would say resistance training as well as nutritional considerations are key.
And I think that sets us up kind of talking about another issue that comes up with pelvic floor is let's talk about constipations and how does that connect with the pelvic floor?
Yeah, absolutely. So it's one of the, I would say it's probably the most common thing I treat as a pelvic floor PT. And it's
I'm shocked by that.
Yeah. So most people are like, wait, how does like I have a questionnaire that people fill out when they come and I ask them about their bowel habits and they're like, why does me pooping have anything to do with my pelvic floor? And I'm like, oh, let me tell you. I would say it's the precursor to a lot of other things. Okay, so constipation is one of the biggest drivers of urinary incontinence. Hot take, most people don't realize that. Constipation is one of the biggest drivers of pain with sex or pain with tampon insertion, any type of pelvic penetration. Constipation is a huge driver for prolapse, or that diagnosis where you may have some shifts in pelvic organs in the pelvic cavity, and so you feel that vaginal or heaviness or pressure. So constipation is so dang important to get regulated, and I harp on it all the time. Like, it is literally one of my favorite topics to talk about and probably one of my patients' least favorites. But by the time they're done, they're like, listen, I feel so much better that I can poop regularly and I'm not straining. And I just overall feel like everything is better. And sometimes, honestly, addressing constipation fixes a lot of those other things that I mentioned. So
while we're talking about constipation, we will just do a quick review of some lifestyle things that have an impact on improving constipation. Kelsey's over here talking about fiber. We love fiber on this show.
Yeah.
Yes, we do. But just a little reminder, fiber is broken down in soluble and insoluble fiber. Both can help with constipation, but we see the biggest impact with insoluble fiber because it's going to help move things through your bowels. And you're probably asking, well, where do we get that in our diet? And some of the foods that are highest in that are going to be nuts, seeds, vegetables for the most part. There are some grains that have some insoluble fibers, but here's the hard part. When people are dealing with significant constipation and they're excited about trying to fix it with their diet, you cannot just go all in and increase your fiber intake within a week's time to your goal because it will not feel good. It is not going to work that way. This is a long game when it comes to increasing your fiber. So really, if you're talking about fiber and constipation, see how much fiber you eat regularly. Just log it for a week, see where you are. And you're wanting to slowly move it up to that 25, 35 grams of fiber a day. And you only want to increase each week by just 3 to 5 grams at a time because your body's not used to it, your gut flora is not used to it, and you're going to feel bloated and you're not going to feel better if you go too fast. The other key to this is, as you work in more fiber, you have to follow it with water.
Yes,
These two things are friends. Fiber wants water, so bring them together, and that is a key. And so, again, see where your current water intake is and slowly move it up. I think this is probably hard for many of these patients, though, because if I'm having issues with urinary incontinence, the last thing I want to do is increase my water because then I have to run to the bathroom. So this is going to, again, take time. So it can be a slow game, and you're going to have to work with your pelvic floor PT on strengthening or relaxing to get used to that higher water intake. But it is something that kind of happens as you start decreasing water because you don't want to have to run to the bathroom. And then the third big thing from a lifestyle standpoint that I always want to bring up is movement. You know, many of us live sedentary lifestyles, so get up, get moving. That also helps with constipation as well. I will throw it back to you. And what have your patients seen the biggest impact in helping with their constipation?
So water is probably the number one thing. And you hit the nail on the head with saying that people are scared a lot of times to increase their water. So what we do as pelvic floor PTs is we work with them. I mean, I have an hour with people when they're in there, so I can strategize with them on like, okay, what is feasible? How can we increase your water where, one, it's not inconvenient for your day, and two, you're not scared that you're going to have more leakage? And so we work on kind of some voiding habits and schedules and things like that to help people increase their water. That's number one. Number two is finding dietary fiber that they like. I'm a big fan of, you can do it with your diet. That is way better than you having to take a bunch of supplements. The body is going to respond to that better. You guys have talked about that on the podcast.
And the fiber supplements tend to cause more gas and bloating than getting it in your food. So I always get that. It was like, oh, I'll just take the supplement. I was like, I don't know. You might not necessarily feel better getting your fiber that way. And the great thing is when you do it in your diet, it typically helps you shove out other things that may be causing more constipation because you're filling your plate with those high fiber foods.
Yes. Yeah. And taking away some things that are constipators, right? Like if you're pounding down a ton of cheese and white rice every day, with a glass of milk, that might, be negating some of your bowel habits. So I go over a little bit. I don't have a degree in nutrition. I go over what I know from the research, and I always advise people if they really need some nutritional support to talk to their physician. And then I teach bowel posture. So we go over a lot of, big fan of the squatty potty over here.
I was going to say, what is your feelings to the squatty potty? When that first came out, I've never laughed so hard in my life when I saw the squatty potty. But then after years of having patients talk about using it and having such great success, I quit laughing. I was like, you know what? That was a great invention.
Yes. Listen, my whole family has squatty potties. My friends with kids have squatty potties. Because I talk about the squatty potty all the time. I'm all about it. So the position the squatty potty puts you in, where your knees are higher than your hips, actually relaxes some of the muscles in your pelvic floor and changes the alignment of your body so that poop can exit easier. So it's legitimately scientifically better for you to poop that way. So we go over that. Most of my patients get some type of stool, if not the squatty potty. So
we will link the squatty potty on the show notes as well if you're not familiar with this great gadget.
Excellent. Love it. Yeah. So we go over that. We go over teaching people how to relax their pelvic floor. That's the biggest thing, is we have so many people out there that are straining and bearing down and holding their breath. And when you do that, the pelvic floor muscles actually tense up. And so you're trying to push something out of tight muscles that are closing the opening for exit, right? So we teach people how to have a bowel movement more successfully and be able to relax those muscles and breathe and not strain, and just talk about things throughout their day that might be impacting that. Movement is huge, like you said. If you are sitting all day long and then you're sitting all night long, your bowels aren't going to move very well. And your pelvic floor is probably going to be really tense from sitting all day. You're sitting on it. Muscles are, they're in a shortened position and they're going to stay that way. So movement is a huge thing that I educate on too.
So I'm taking away, because honestly, I had never really thought about the pelvic floor's relationship with constipation. I've thought about it when people have trouble holding their bowels in, which I want to come back to. But that makes sense. If you're tight, then things can't exit.
Yeah.
So thinking about someone that sits all day for work, is there anything in particular? We try to encourage people to get up every hour, at least for 10 squats or, a quick walk down the hall. Is there anything in particular that they can do during those short breaks that would help?
Yeah, diaphragmatic breathing is my favorite thing, because when you do, and I'll also send you a link I've written a blog post on that too, so people can check that out afterwards, so that I won't go into too much detail here. But when we breathe with our diaphragm and it moves up and down, it actually works like a piston, and it actually helps to lengthen and relax our pelvic floor. So even you can do this sitting at your desk. This is my patient's favorite thing because it's very relaxing. A lot of them do it before bed. A lot of them do it first thing in the morning. They do it throughout their workday. You can do some of that diaphragmatic breathing, and it's literally like a mobility exercise for your pelvic floor. So that can really help negate a lot of the effects that sitting has on people.
And then I love breathing to help with stress reduction.
Oh, 100%.
Let's connect it all. It's great. You get lots of advantages there.
Everything circles back in lifestyle medicine.
Now we'll do the opposite that Kitty had just mentioned. Tell us about pelvic floor and fecal incontinence. So when people are having a hard time holding their stool.
Yeah, so it's something I don't see as often, certainly as urinary incontinence. I see it a lot with severe birth trauma. So if people are having significant perineal tearing, sometimes people experience fecal incontinence because they'll have some tears to those muscles that help to stay contracted so that stool doesn't exit. I also see it a lot for people that are having IBS with diarrhea or other gastrointestinal dysfunctions where they are having a lot of loose stool. So it's really hard to control because their muscles have to be a lot more turned on and tense to control that. But there's a lot that you can do for it. So there's a lot of work that we do. Most of the time with fecal incontinence, there is usually either a weakness in what we call the external anal sphincter. It's the muscle that when you think about if you were going to pass gas and you want to hold it in, that's your muscle that you contract. There's either weakness there or there's like a mistiming. So that muscle doesn't fire with other muscles up the chain well. And so some you can control, some you can't. But in pelvic floor PT, we work on both of those things. So we'll work on a lot of bowel training to help with what we can control and then also help make changes that help to impact those things that we can't directly control in our body.
So I had quite a few older female patients that had trouble with this, and it really impacted their quality of life because they didn't want to go out and do things because they were worried. They had chronically loose stool for multiple reasons, microscopic colitis and just chronic diarrhea type of things. And so it really would keep them from doing a lot of things with family and friends. And so how often do you see success with doing pelvic floor PT for something like that?
Yeah. So I would say it varies. I don't have an exact statistical number to give you. And there's some things that are changeable and there's some things that we need additional interventions on. So I work very closely with colorectal physicians here in Lexington. We have a really amazing group of them here and to help with getting stool consistency better. So they may add some different medications or lifestyle modifications or things like that to help with getting better stool consistency. Someone may have, and I didn't mention this earlier, but someone may have fecal incontinence from like prolapse, which I mentioned earlier. And that can be from birth. That could be from just lifestyle things. It could be from a lifelong history of constipation. And so there are times when pelvic floor PT helps to treat that and can make that function perfectly fine. There are also surgeries that can be done to help with that as well. So sometimes we may do pelvic floor PT in addition to some of those other interventions to help. But I would say, there are solutions. And then, even if you've done everything, so if you've done pelvic floor PT, you've worked with your colorectal physician to work on stool consistency and you're still having leakage, there are even like implantable devices they can use to help control fecal incontinence. So not something you have to suffer through.
Now, we're talking about some things that we're seeing more often as people age. What happens to the pelvic floor with age, and what are some of the more common things that you see in patients, say in their 60s or 70s, because we know that there can be changes over that time. A lot of times we focus a lot on postpartum women, but what are we seeing in like postmenopausal women?
Yeah, that's a great question. I get asked that a lot in my workshops. So when we go through menopause, we have a drop in estrogen. So our body's no longer producing estrogen. Estrogen's a really important hormone for our pelvic floor. It actually, the more estrogen we have, the more blood flow we have to our pelvic floor muscles. Muscles love blood flow. And so when we have a drop in that estrogen, we actually have a drop in that amount of blood flow to our muscles. And so our muscles will experience a little bit more atrophy. And atrophy just means the bulk of those muscles may decrease. So we might see an increase in incidence of urinary leakage, fecal incontinence, prolapse, those types of things. So that can be a big factor. We'll also see some changes to vaginal lubrication. So estrogen helps to supply lubrication vaginally. And so as that decreases, we may have a greater need for some external application of lubrication vaginally. So we see a lot of things like UTIs and yeast infections in older adults. And a lot of times it's because that tissue is not getting hydrated and lubricated well or has like a super low estrogen content. And so there's a lot of supplemental stuff you can do for that. But those are some of the biggest changes that we see.
And we talked a little bit with Dr. Bashir about this and how even topical estrogen in those later years of life can make a big difference in those
100%.
Symptoms without even have to take systemic hormone replacement therapy.
For a postmenopausal woman that's struggling with urinary incontinence, I had a lot of women just tell me they were feeling some pelvic pressure, even when they weren't necessarily having a significant prolapse, but they were contemplating surgery and things to help with that. I always encourage them to do pelvic floor physical therapy first to see what kind of benefit they got there. How often do you see that being helpful for someone and being able to put off like a sling type surgery?
Yeah, that's a really good question. So and as well as all of the research supports doing pelvic floor PT prior to surgery because if you look at any of the research, and my patients all Google this ahead of time and then they panic, pre-surgery, the risk of reprolapse postoperatively is high, right? So like the failure rate of those surgeries is pretty high for a surgery. And so, but in patients who do pelvic floor physical therapy before surgery, that risk of failure and that incidence of success goes way up. So it's way more successful to have those surgeries if you've done pelvic floor PT first and learned how to use your pelvic floor, gotten stronger where you need to get stronger, learned how to manage pressure. Pressure is a huge predictor for prolapse. So if you're bearing down all the time when you're bending over to get something out of the oven or clean out your dishwasher or picking up stuff off the floor, and you have a prolapse surgery and never fix that, you never learn how to, not hold your breath and bear down every time you do stuff, then you're going to have a higher risk of reprolapse. But if you're doing some pelvic floor PT first, it can help you with your surgery. And then I do see a lot of cases, if it's a mild prolapse, pelvic floor PT is the indication. Like, surgeons are not going to operate on somebody that has a very mild bladder prolapse or a very mild uterine prolapse. Pelvic floor PT can really, even if the anatomy doesn't change, the symptoms can oftentimes be resolved.
I saw it make a huge difference for a lot of patients of mine. But one other thing I saw was sometimes I would send someone for pelvic floor PT. They would come back and tell me how much better things were. And then they would stop PT. And then a year later, we're kind of talking about this again. So any advice for women that go through pelvic floor PT to help with these types of symptoms and see success? What do they need to continue afterwards?
Yeah, I'm sure you guys talk about this a lot in lifestyle medicine. Like, it's a lifestyle change, right? It's not just you're going to do this for 8 to 12 weeks and then not think about this ever again. Now, my goal is not for people to have 15 minutes of pelvic floor exercises they do every day for the rest of their life. That's obnoxious. Nobody wants to do that. But my goal is to integrate the isolated specific exercises into day-to-day life. So, for example, I'm going to teach you how to lift something off the floor so that you're not putting strain on your pelvic floor. And then I'm going to expect you and encourage you to continue to use that strategy, right? That doesn't add any more time to your day. You're just going to use the strategy I taught you. We're going to talk about how to not be constipated, and I want you to continue to use those strategies. We're going to work on getting muscles stronger so that they fire automatically when they need to, so that when you're going to the gym and you're doing sit-ups or crunches or planks, your pelvic floor is automatically doing what it's supposed to do, so that you're no longer having to think about, oh, am I doing my Kegels today? It's just coming along with you in your day-to-day life. And those are the keys. I always tell people I'm trying to work myself out of a job. Okay, I don't want you to have to come back and see me for the same problem. If so, I didn't do my job well, because I want to be able to train you to have long-term success with that.
Are there any common things that can happen in women's lives that will cause it to flare back up?
For sure. Biggest thing, I call it the episodes of Christmas constipation. I wrote a blog post on it. Christmas constipation is hands down. I can have patients completely leak-free for months. They're going to the trampoline park. They're doing great. Christmas happens. They get constipated, or they go on vacation. They get constipated, and they come back to me, and they're like, I'm peeing my pants when I sneeze again. So the Christmas constipation, that's the biggest one. Obviously, like pelvic trauma, having a fall. This winter, I saw a lot of my patients that fell on the ice and injured their tailbone. Oh, my gosh, the pelvic floor is totally going to respond to that. So that can develop tension and issues related to that. Some medication changes can have an impact on the pelvic floor, and then lifestyle factors like what you're eating and what you're drinking, all of that kind of stuff is going to play in, because there are certain things that irritate the bladder, the bowels more, and that can cause you to have a little bit more risk for leakage or urgency or those kinds of things.
One question for you. This is something hard to control. If you come down with something and you get one of those awful chronic coughs, let's say that just won't go away and is pretty intense.
Yeah.
Is there ways to help keep that from flaring it back up?
Yeah, so that can definitely be a factor that we can't control, right? And I tell people, if you get the flu and you are literally coughing nonstop for 2 weeks and you have a little bit of return of your leakage, don't panic. The pelvic floor can adapt, and that probably will resolve once you're feeling better. But I do teach strategies. So, perineal pressure. So like, you wouldn't do this out in public, but if you're at home and you feel like, listen, I've been coughing for 2 weeks, my pelvic, there's no way I can Kegel anymore. Okay, like I can't Kegel when I cough. That's one thing I teach is to do a Kegel when you cough. Then I'll have people put hand pressure at like the urethra. That can kind of signal those muscles to naturally contract.
I just tightly like cross my legs.
Yes, that works well. Okay, so when you cross your legs, your inner thigh muscles they work with the pelvic floor. So great strategy, especially now. My goal is not that has to happen forever, but if you're really sick and you have that deep cough, I mean, my gosh, that's a lot of pressure. Even position changes. So some of my patients do better if they feel a coughing fit coming on to sit down or to lay down, or some people do better with standing up. So changing your position to kind of control where that pressure is going can be helpful, but sometimes it's unavoidable. I got the flu 2 years ago, and I had an all-new appreciation for what women go through that have concerns for their pelvic floor when they're sick, because I obviously know how to contract and relax my pelvic floor, and it got real hard come week 2 with my chronic cough, so I get it.
Lived it last year, so that's why I brought it up. I was like, I got one for you.
Yes.
Well, you've mentioned the word that I think is the first word that comes to everyone's mind when I say pelvic floor, which is Kegel.
Yes.
So is Kegel the ultimate? Is that the gold standard for what you need to do if you're having pelvic floor issues?
Yeah, so it is not. Hot take. Let me just throw that out there. I do think social media is getting better about educating about this. 5 years ago, everybody's like, do all your Kegels. Okay, 5 years ago.
I think that's all we learned, wasn't it, Kitty?
Yeah, definitely.
I was just like, that's all we learned in patients.
Exactly. Right. And so patients come to me and they're like, well, my doctor just told me to do 100 Kegels a day. And I'm like, well, honestly, that's what we were taught 5 and 10 years ago. And it's only until recently the narrative is kind of changed. So the pelvic floor does not ever function in isolation. So sitting and doing an isolated Kegel, which is just basically where you contract your muscles like you're going to hold in gas or urine, the pelvic floor never really does that just by itself. It functions as part of the core. So I'm never going to give people a lot of isolated Kegels without also having them activate other muscles of their core. So their ab muscles, their back, their diaphragm. There's always going to be like functional implications with it. So to sit and just do Kegels is not really going to get you very far in pelvic rehab.
Are there other basic exercises that you would tell people to try out if they just had concerns before they even came to see a PT?
100%. So in the blog post that I'm going to link to this, I actually have some exercises in there. So definitely, if you guys are interested, check that out. I explain it and walk people through it. Mostly what they are is just learning to kind of connect the 4 parts of your core. So your diaphragm, your pelvic floor, and your abs, and just working on that connection and then applying it to functional movement is literally the best thing you can do.
And then if someone tries that or maybe has some other type symptoms, like when should someone be like, okay, I need a pelvic floor therapist?
Yeah. So I also, sorry, you're going to have a lot of links in the show notes. But
That's great. Make sure you check them out, guys.
There's a really great screening tool. It's a free screening tool. It's called the Cozy and Screening Tool. And it basically lists I think it's 10 or 12 symptoms. And if you have 3 or more of those, it is indicated to go to pelvic floor PT or to talk to your doctor about pelvic floor PT. So that's one way that people can know. But basically, if you've tried, working on doing Kegels, or you've tried relaxing your pelvic floor, you've done your diaphragmatic breathing, or you've checked out our blog posts that talk about, how to connect all 3 of those things, and you're not getting better, go see somebody. Even if it's just, I have people that come see me just for a screen. They're like, I don't know what my pelvic floor is doing down there. Can you just tell me if I'm doing stuff right or not? Because I want to make sure if I'm at my Pilates class doing my pelvic floor and ab contractions that I'm doing it well. And so getting screened is a really great tool too. So
now, if someone comes to see you, are there times that you are like, nope, I think you need to go see a surgeon? Or is that something typically they work with you for a long time before you ever come up with that conclusion?
No, there's very few cases where someone's come to me and things are so severe that I recommended them go straight to surgery. There have been some cases where there's a spinal cord injury or things like that might have been missed and stuff. So yes, in those cases, absolutely sending you straight to surgery, to the emergency room. But in most cases, I'll try to see people and see if we do a conservative approach for maybe 3 to 4 sessions, if we can make a significant change in their symptoms. And then if not, then we'll talk about other options. I'm not in the business of wasting somebody's time. I don't want you to come see me forever and then, me know at the beginning of our treatment, we were never going to get better, right? I'm going to send you to a surgeon if I don't think that I can help you. But I usually will try a few sessions to see first.
So I remember when I was early in my practice and I'd had a patient go to pelvic floor. I think her gynecologist had sent her for pelvic floor physical therapy, and I really didn't know much about it. I was imagining Kegels.
Yeah.
And she came back and told me about it, and she had improvement, and she was like, but I wasn't ready for what was about to happen. And so she told me, and I'm going to let you kind of tell listeners so you can have that expectation. And I made sure I always told my patients afterwards, if I was sitting them to pelvic floor, hey, this is a little bit different than the PT you did for your knee, where maybe you were in a room with a bunch of other people. This is more of a private thing and can be a little, I don't want to use the word invasive because
it doesn't have to be, but it can be. It can be, depending on what we decide to do. So that's a super good point. And I was going to bring it up if you didn't. But so as a pelvic floor physical therapist, what we go to additional training for is to learn how to do an internal examination. That's the gold standard for assessing the pelvic floor muscles, is inserting a single gloved finger vaginally and having you contract and relax those muscles. That's the way we can feel those muscles. It is the gold standard. It is not the only way. So I have a lot of people that come see me and they are 0% interested in me ever doing an internal exam with them. And that's okay. We have a lot of other techniques, that indirect techniques, where we can get a good feel for what might be going on. So I tell people it's something that if you're comfortable with can be very valuable in your pelvic rehab. If patients know what to expect, sometimes we'll do that on the first session. Patients aren't expecting that. I don't usually do it on the first session because I don't want to have somebody come in and be like, hey, so we're going to do a pelvic exam now. And they're going to be like, heck to the no, right? And run for the door, okay? So if I've talked to somebody ahead of time, if I've kind of told them and they're open to it and they're fine with it, great. If somebody has a history of horrible pain when they get a pelvic exam, I see a lot of people that can't have a pap smear because they just can't tolerate it. There's no way in heck we're doing that for a while. We're going to work on a lot of other strategies. So it can be, but if you're seeing a pelvic floor PT that is forcing you into doing an internal exam and you're not comfortable with it, run for the hills. That is not a safe space. And so your pelvic floor physical therapist should make sure that you know what to expect and you feel safe and comfortable in that environment.
But in general, having that internal exam can give you more information and probably better treat. And I know a lot of patients mentioned to me about maybe some devices that were used during that. And I know when I look on Amazon, when I get on Amazon, I search pelvic floor device. There are a lot of things that come up, like the pelvic floor trainers, which looked to me like kind of fancy thigh masters.
Yeah.
There were Kegel trainers, pelvic rockers. So what kind of goes on with all that stuff?
Okay, so there's a lot of dilators are probably another one that you might see. Pelvic wands, which look like a torture device, So there's a lot of different tools we have in the pelvic floor world. I am not a big fan of Kegel trainers. Let me just say that first. Those are like the weight things that people will use, or they also make this thing called LV is one brand, but you insert it and it tells you, how many contractions to do and if you're doing them right and all those things. I'm not a big fan of that stuff because it's not functional. When are you ever going to walk around with a weight inside your vagina? Like, that is not functional.
Hopefully never.
Hopefully never.
I don't plan on that.
Let's not do that. All right. So it's not functional. So I'm not a big fan of the weighted stuff to help with strengthening the pelvic floor. So you're not going to see a lot of that in my office, but it's not always inappropriate. There have been scenarios where I've used it short term for people who had desensitization or severe weakness where they're like, I can't even feel what's happening down there. So it's not completely out of place, but not commonly used for me. I do use things like dilators and pelvic wands for people who have pain with penetration. Dilators are just graduated cylinder. They kind of look like a tampon applicator, and they start really small and then get bigger to help people feel comfortable with insertion of a speculum or insertion of for sex or those kinds of things. So we do use those in some cases for...
And that, just so I can stop you there, because I think a lot of people have the misconception that the dilators are to try to kind of stretch you out, but it's really not stretching you out, right? It's like learning, that's a way to train your muscles to relax.
Yes.
Is that right?
Yeah. There's some stretch component to it, but the stretch component is done to cue the relaxation, right? So it's more of teaching your nervous system how to regulate to that stimuli, how to relax those muscles, and how to emotionally even like connect and relax with that. Because a lot of people that have had pain, this was the case for me, like are super fearful of any type of vaginal penetration. And so it can really help with that emotional response too. So I use those a lot.
while we're on the topic of that, I know a lot of times people are hesitant to come to their doctor about having pain with intercourse.
Yeah.
But that's also a great time to see a pelvic floor physical therapist, right?
Mm-hmm. Yeah, absolutely. So that's what brought me into this field, and that is what I love to treat. It's not something that's talked about, and honestly, it took a variety of physicians before I even got a referral for that. Like, I was terrified to talk to my doctor about it, and then some doctors were just like, well, you just need to relax, or have a bottle of wine, and I'm like, that is certainly not a good solution. What is that? Okay, let me just start a not great habit to be able to do this other habit, right? And so it can feel really scary. And that's one thing that I try to do. I do a lot of phone consultations with people. They just have questions, so they'll call me. And I say, listen, it can feel really scary. Find a provider that you feel comfortable talking to, but know that you don't have to live with this, and there's help. And pelvic floor PT, it changed my life. I have seen it change so many other people's lives in that area. It's so effective at getting people back to pain-free sex.
I think women have it's been such a topic that's difficult to talk about that so many women just accept like that's just how it is for me. Yeah. But it doesn't have to be. And I think our generation is getting more vocal about that. And then the generation under me is definitely more vocal than our generation.
Each one's getting better.
Yes.
And anything in particular with that pain after sex in relationship to post-pregnancy that you have good advice for?
Yeah, so we see it a lot with people who have perineal tearing or trauma to that area. And so there are some really great perineal massage techniques that you can even get on, trusted websites and find out more info on. But there are different massage techniques you can do to help that tissue, that scar tissue, heal and recover. When done in an appropriate time, do not do this before the first 6 weeks or cleared by your physician. Let me just add that disclaimer. But there are techniques that you can do to help with that. But I do see it a lot if people have some significant scarring or trauma during birth.
Another thing that many women experience is they will have a hysterectomy at some point in their life. Mm-hmm. That is something that some do experience. How does that impact the pelvic floor?
Yeah, so similarly to what I had talked about earlier, when you have a hysterectomy, it depends, if it's a complete hysterectomy where they take your ovaries or if your body's still producing estrogen. So if you have a complete hysterectomy or you're postmenopausal, then your body's not going to be getting that estrogen production. So you're going to have some of those symptoms like vaginal dryness, muscle atrophy, decreased blood flow vaginally, that kind of stuff. If you have a partial hysterectomy, there's still some changes that happen even if your body is still secreting the hormones because your anatomy's changed. So you've lost some of your support structures. So, and it depends on, how the surgery was done, if your cervix was left, not left, all of those different things. But your uterus, takes up space in the abdominal cavity. And so when it's gone, some things are going to change a little bit. And so some people can experience some changes to continence or pelvic pressure, things like that, post-hysterectomy.
Well, before we wrap this up, I wanted to jump into one other topic, and that is exercise. So I have various questions around this, but one thing that is really popular now is the Peloton. And I've never been able to get into the Peloton because, honestly, it just hurts my butt to sit on a bike.
You gotta give it time, Kitty. You gotta give it time.
It hurts.
I'm a Peloton lover. So.
I know you are.
It took me a while, though.
And so is that okay? Is it okay that you just keep going until your butt doesn't hurt anymore? That just seems like...
So I'm a cyclist, so I am going to probably sit along with Sarah on this. But let me just say, first off, padded shorts can do a world of good for this department. Sarah, I don't know if you've experienced it.
That's what I had to use to get into the Peloton.
Yes.
So for months, when I first got a Peloton bike in 2020, that's what I had to use. That was the way.
Great.
They're great. They look really silly. You're not going to wear them in public.
No.
Or maybe I will.
Yes. So, okay. One, padded shorts, very helpful. But there can be some pelvic floor implications. So for some people that have pelvic pain, sometimes sitting on a bike seat might make it worse. If you've got tailbone pain, if you fell on the ice, you're probably not getting back on your Peloton, day 2, right? So it can make some things worse. It can put people at risk for pelvic floor muscle tension. Not always. I'm not saying everybody who cycles or rides a Peloton experiences that, but it can be a risk factor for some people. I can tell you, if I get get off a 2 or 3 hour bike ride from sitting in that seat, I've got to probably think about relaxing my pelvic floor, So it definitely, it doesn't have to be a harmful thing for the pelvic floor. And let me just say, it is uncomfortable when you get started with either a stationary bike. I would even argue stationary bikes are probably more uncomfortable getting started with than like if you're cycling on a road bike or mountain bike outside, because you're more in one position, but it will get better. So let me encourage you, Kitty, if you decide to do some Peloton work, it will get better. You just got to overcome the first few months or so.
Another form of exercise that some people are like leery of if you're having pelvic floor issues is weightlifting. And we're always promoting resistance training on this show. But what would your take on that be?
Yeah. So another blog post on this one. So I'll give it to you guys to link in the show notes. But weightlifting is amazing for the pelvic floor, but it can be harmful if done incorrectly. Just like weightlifting can hurt your back if done incorrectly. So if you're not using good form, or you're holding your breath, or you don't know how to use your core system well, then it can be harmful, but it can also be wildly beneficial. I have my postmenopausal people doing squats, deadlifts, things like that, and using their pelvic floor functionally with those things to help them so that when they're gardening or when they're cleaning out their dishwasher or getting something heavy out of the oven, their pelvic floor knows how to function. And resistance training is just so wildly important for women, especially because we lose bone and muscle mass as we age. So super important, but important to do well.
Well, Kelsey, oh my goodness, you have given us so much great information. So I'm going to summarize, and then I want you to tell our listeners how they can get in touch with you and maybe some events you have coming up. So just to summarize, I think the first thing to remember is the pelvic floor is not just something that acts in isolation, but it's the bottom of the core, and it's connected to lots of other muscles, and they all have to work together in order for it to function well. So you might have a problem with your pelvic floor if you are experiencing urinary leakage, pain with sex, constipation, bowel leakage, not feeling like you can empty your bladder appropriately. So if you're having any of those symptoms, definitely look to finding a pelvic floor therapist to help you with that. Remember, with pregnancy, it's not just strengthening, but also learning how to relax and get mentally connected with your pelvic floor. And you don't have to just succumb to absorbent underwear for future trampoline jumping. You can learn to retrain things, and we learned that it's never too late, even if you're 8 years after having twins. So don't give up hope, and you can learn more about this. One thing that you really stressed that I don't think I truly appreciated the significance of is the constipation relationship to these pelvic floor muscles and the need to both prevent constipation from a nutritional standpoint, but also really learning how to relax that pelvic floor in order to relieve that. You're going to try some diaphragmatic breathing during your breaks from sitting throughout the day to try to help with that as well. And then remember, especially in the postmenopausal days, we want to try to increase blood flow to our pelvic floor the best we can, since that diminishes over time and with our hormonal changes. And Kegels 1,000 times a day are not the answer. You really want to learn how to do Kegels with other movements that are activating other parts of the core. And then if you are having pain with intercourse, this is also a great solution for you. So go ahead and look into that if that's something that you're struggling with. And don't give up on riding the Peloton if you hurt the first time.
It will get better.
So tell us, where can our listeners find you?
Yeah, so I work for a company called Move Smart. So you can go to our website. It's www.movesmartky.com. Our Instagram is MoveSmartKY. And then you can always email me. It's just Kelsey, Kelsey at MoveSmartKY.com. And then I wanted to share some exciting events that we have coming up. So I like to do a lot of free workshops through Move Smart. And so you can come to either one of our upcoming free workshops. We've got a perimenopausal event on the 21st of April. It'll be at Crank and Boom, so you get free ice cream. I mean, come on. We're going to talk about your pelvic floor and you get ice cream. It's a win. And then we have a pre and postnatal workshop on May 7th. The time and the location is to be determined on that one. And I can give you all the information to share on the podcast links. And if you follow along with us on Instagram, you'll see all of our free workshops posted there. You can come and join and learn more.
Yeah, they've got a great Instagram account.
Yes. We have a really great person managing our Instagram account. So,
all right. Well, we appreciate your time and all of your expertise, and really excited to continue on our Women's Health Month here at the Starting Gate. Next week, we will have Alexis McNally, and she's going to be talking about your menstrual cycle, as well as like learning how your menstrual cycle even works and what your menstrual cycle could be telling you about your health. So that show is very relevant for many women out there. So please be sure to tune in to that. And we're just excited that we have all these fun things. And this is also one last time to let you know that there is a women's health event that we are a part of that will be March 30th called the Thrive event. Kelsey is also speaking at that event as well, aren't you?
Yes.
So there's still a few seats left if you want to come join us. So be sure to check that out, because Kitty and I will be speaking, and we're just really excited to help bring a lot of information to women in Lexington.
And as always, follow us or click on that send us a text link and let us know anything else that you'd like to hear about. We'll see you next week.